Welcome to the Counselor's Soapbox video channel. In today's episode, we're going to talk about learning about alcohol, part 13. We'll cover pregnancy, sexual functioning, and some other miscellaneous physical problems that have not been discussed previously in this series. Alcohol has a number of impacts on the reproductive system and pregnancy. It results in decreased fertility, skipped menstrual periods, diminished libido, impotency, sterility. Heavy consumption of alcohol can cause men's breasts to grow, their testicles to shrink, and the loss of body hair. It also causes fetal alcohol syndrome. Many people are familiar with this. In fetal alcohol syndrome, there are visible birth defects. The baby is smaller, has a small head and arrested brain growth, jittery and tremorous, cardiac problems, and has intellectual disabilities. We used to think that this only happened to women who drank heavily during pregnancy. We have since found that there are milder forms of this disorder and that no amount of alcohol is safe during pregnancy. Fetal alcohol effects are those results of drinking during pregnancy, which, while they may not cause the physical symptoms, result in learning disabilities. And in fact, recently there's been identified a disorder we now call fetal alcohol spectrum disorder, which ranges across all levels of drinking. Result, no amount of drinking is safe during pregnancy. How does alcohol affect pregnancy? One drink per day increases the risk of abnormalities. The greatest risks are during the first 3 months of pregnancy. Unfortunately, many women do not know they're pregnant that early. 1 to 2 drinks per day doubles the risk of spontaneous abortion in the second trimester. Mothers over 30 are more likely to have children with impairments. Alcohol disrupts nerve cell development. It readily crosses the placenta and diffuses throughout the fetus. Children have an immature liver. Therefore, the fetus cannot detoxify the alcohol, meaning with alcohol or any drug, the fetus always receives a stronger dose of the drug for a longer period of time than the mother, because the blood has to leave the mother, cross the placenta, go through the fetus, return through the placenta, and move through the mother's bloodstream in order to reach the liver and detoxify. Blood alcohol content, therefore, is higher in the fetus. Alcohol results in long-term growth impairment, which can be seen all the way up to age 10. And for fetal alcohol syndrome, the IQ will typically be in the range of 68. For fetal alcohol effects, in the range of 73. Note that 85 is the lower limit for a normal IQ. A little more on fetal alcohol syndrome. At the left, you will see a picture showing some of the physical effects. But at age 16 and a half, children with fetal alcohol syndrome are equal in development to a 7.5-year-old. 95% of those children with this diagnosis have been in special education. They will be impulsive, lack social inhibition, and are likely to be diagnosed with ADHD much more often, and a form of ADHD which does not respond to medication. We also see behavioral problems in those people diagnosed with fetal alcohol syndrome. Inappropriate behavior, potentially dangerous behavior, inappropriate sexual behavior, and there's no improvement with age. Only about 5% of those diagnosed with fetal alcohol syndrome will ever be able to live alone and be self-sufficient. Besides the reproductive system, there are a number of body-wide systems which are affected by alcohol. The respiratory system is important among those. Alcohol affects normal breathing. Low to moderate levels decrease respiration, but high doses will decrease respiration and could be fatal if it's high enough. There's a high association of smoking and drinking. Smoke and drink together increase the risk of lung cancer. People who drink and drink heavily have more infections and are more likely to contract tuberculosis. Alcohol affects the endocrine system, resulting in premature aging, a deepening of skin pigment, sometimes producing a dirty tan color. It can alter carbohydrate metabolism and results in unstable blood sugar, both low and high. Alcohol consumption increases cancer risk. There's a connection to cancer of the skin, the thyroid, laryngeal cancer, oral cancer, head and neck cancer, esophageal, stomach, liver cancer, lung, colon, and breast cancer. Alcohol affects the skeletal system. It increases the risk of 4 types of arthritis: gouty arthritis, degenerative arthritis, septic arthritis, and osteoarthritis. Alcoholic pancreatitis also increases the risk of arthritis, as does the osteoporosis. Alcohol affects the nervous system. Of course, alcohol results in tolerance and withdrawals. The effects of the withdrawal from the drug are typically the opposite of the intoxication effects. We sometimes call this withdrawal abstinence syndrome. Another key characteristic of the effect of alcohol is cravings, and alcohol is a trigger for cluster headaches or migraines, can result in jumpiness, edginess, irritability. As the blood alcohol content lowers, there can be intention, tremors, shakes, fever, tachycardia, hypertension, seizures, and hallucination. Excessive alcohol consumption can result in organic brain disease. It results in reduced volume both of the gray matter and the white matter, disruption of white matter tracts, which are the connections between various parts of the brain. This can lead to dementia or an organic brain disease. Cerebral atrophy occurs. The brain actually shrinks. There are several disorders that have specific names and diagnoses. Wernicke's syndrome, Korsakoff syndrome, often found together, can be caused by a deficiency of B1 vitamins. These will exhibit lateral eye movement issues, difficulty walking, and a phenomenon known as confabulation, in which memories are not present, but the brain pulls up memories from another time or place and inserts them. So people who have developed these brain disorders, when asked a question, will give you an answer they believe to be truthful, but in fact, which is totally wrong. Alcohol consumption can result in nerve and muscle tissue damage. There's an alcoholic polyneuropathy. Muscle damage occurs in 40 to 60% of heavy drinkers. Pressure necrosis happens from passing out and not moving. There can also be muscle cramps, diminished vision, and frequent head injuries. Heavy or long-term alcohol consumption can result in psychological changes. There could be personality changes. They have difficulty solving problems, difficulty performing complex motor tasks, can't use abstract concepts, and there may be memory impairment. Some other alcohol-related problems. Drinking makes Hodgkin's disease worse. It can reduce social anxiety, but it has a strong rebound effect. So when people drink alcohol to manage anxiety and the alcohol wears off, they are more anxious than before. Alcohol consumption worsens chronic fatigue syndrome. and may affect many metabolic disorders. Drinking results in post-operative complications. 1 month of abstinence before surgery is recommended. Many common health problems are made worse by low to moderate drinking. Alcohol results in sleep disturbances. Many people think that taking some alcohol can help them sleep, but in fact, there's a different condition in the brain when you drink versus when you sleep. Being unconscious from excessive alcohol consumption is not the same thing as sleeping. Alcohol actually interferes with sound sleep. The memory is offline during sleep. Use of sleeping pills can result in rebound insomnia, and alcohol can disrupt sleep for 2 years after someone stops drinking. Alcohol affects the memory in a number of ways. One of those is blackout. Blackout is not passing out or losing consciousness, and blackout is nothing related to repressed memories. They're blank spaces in the memory. There may be a total blackout or a partial blackout, which is sometimes referred to as grayouts. These happen when people drink too much and reach intoxication too quickly. They drink more heavily than they usually do, or drinking faster increases the chances. Drinking more over a longer time increases the risk. Other risks are diet, head injuries, and gulping drinks. 30 to 40% of young light to medium drinkers will have at least one blackout. During a blackout episode, the person is walking around, talking, and functioning, but the next day will have no memory for that period of time when the blood alcohol level was high. Psychology has identified a thing called state-dependent learning. The idea here is that if you have a certain chemical in your bloodstream when you learn something, you may not be able to recall that information without that drug in the system. It's as if while drinking, information you learn goes in a filing cabinet labeled alcohol, and when you're sober up, that file cabinet gets locked. The next time you drink, that file cabinet opens again. So alcohol can affect the way information is stored, how information is retrieved. Errors can occur at both times, and sometimes information can get scrambled or mixed up in the process of storing and retrieving it. 4 different alcohol withdrawal syndromes have been identified. Not everyone experiences withdrawal from alcohol in the same way. One variety of withdrawal response is hyperarousal. The person has high anxiety, irritability, insomnia, loss of appetite, rapid heartbeat, the shakes, startle response, and an increase in temperature, a fast pulse, and elevated blood pressure. They may sweat, have a flushed face, and trouble sleeping. A second variety, less common, is alcoholic hallucinosis. 25% of people experience this in the first 2 hours of withdrawal. They can have very bad nightmares. Another variety of withdrawal syndrome is convulsive seizures. These can include generalized, grand mal, or major motor seizures. The eyes roll back, the body muscles contract, and there is a loss of consciousness. The most severe form is delirium tremens, DTs, and this may be fatal. They have hallucinations and shakes, and these get worse rather than better as time goes on. Alcohol is probably the rare example of a drug in which people die while withdrawing rather than while intoxicated. What's ahead for the Counselor Soapbox video channel? More learning about alcohol videos, more drug education videos, and some mental health and wellness videos. If you've enjoyed this video, please click the like button directly below and subscribe to receive new videos as they are completed. For more information, please visit the counselorsoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.